Pharmacy. Happy Monday. I was trying to make another backup, but for some reason it's not connecting. But we'll see, maybe next time. I don't want to waste my time anymore, but Zoom is not linking to YouTube because I wanted you to have those links as we present to help you with the drug words and such. I really don't know, before the class started it was linking and now it's not linking anymore, just my luck. But anyway, so again, let me make that announcement. If you don't have sharing capability, make sure you send your PowerPoint to me so that I can share it to class in your behalf. I only got Shauna's and I only got James. James, I didn't know who is.
No, sorry.
No? Okay. So without further ado, let's start off with Celebrex. Take notes.
Okay. So Celebrex is the brand name. The generic name is Celebrex, and it is used to treat pain and or inflammation caused by different types of conditions such as arthritis or menstrual pain. And it does that by reducing the hormones. The therapeutic class is the anti-inflammatory. For the pharmaceutical, it is a COX-2 inhibitor NSAID. It's RX only. For the pregnancy category, it did say C, but if you are 8 weeks or more, then it would be class D. And then for important information, it may cause stomach or intestinal bleeding, which can occur without warning, mainly in older adults. It can increase risk of fatal heart attack or stroke. And do not use this if you have had before or after heart bypass surgery, allergic to sulfa drugs, or have history of asthma attack after taking an NSAID.
Correct. Okay, important information about Celebrex. The brand name is Celebrex. The generic is Celebrex because it came from its pharmacological COX-2 pharmacological class, COX-2 inhibitor. Okay. The category, the class, the pharmacological class is usually the chemical name of the drug. Okay, that's why COX-2 inhibitor. NSAID. It's also an NSAID. To be more specific, it's COX-2 inhibitor, but it is more an NSAID. An NSAID, I'm trying to find my chat box. An NSAID stands for non-steroidal anti-inflammatory drug. Non-steroidal anti-inflammatory drug. Okay. Non-steroidal anti-inflammatory drug, which tells you non-steroidal, not steroids based. Get it? Non-steroidal. Because that tells you again another information that steroids are anti-inflammatory in nature. Get it? So this group of drugs, NSAIDs, are anti-inflammatory, but they're not steroid based. You follow? And the number one side effect of NSAIDs, which always comes out on major exams, such as your national certification exam, is gastric bleeding. Gastric bleeding. You follow? So in our list today, you have other anti-inflammatories in there, and you have other NSAIDs in there. In general, NSAIDs have a side effect of gastric bleeding. So in medication therapy management, or if it's an application question on the board exam or in exams, so it can be worded this way. A patient comes in, complains about gastric bleeding, okay? Complains about not even gastric bleeding, but nosebleeds or just bleeding in general after taking this medication. Which amongst this medication may have caused the bleeding problem, okay? So you will be given 3 drugs, and then 1 drug is an NSAID. It can be Celebrex. It can be aspirin. It can be ibuprofen, because those 3 examples I just mentioned are NSAIDs. Can you follow? Okay, so NSAIDs have a side effect of gastric bleeding. That's why when we give NSAIDs like ibuprofen, aspirin, Celebrex, it should be given with food or after meals. So when my son had his toothache, I was alternating Tylenol, generic acetaminophen, Motrin, generic ibuprofen. Okay, he can take Tylenol without food, but if I'm to give him a dose of ibuprofen which is an NSAID, okay, I have to make sure that he has food in his stomach to not have any gastric irritation or gastric bleeding. Tylenol, acetaminophen, on the other hand, is not an NSAID. Come on. I know it is your toothache. I shouldn't have mentioned you. I'm sorry. That's with headphones, okay? Sorry about that. But it's my toothache you're talking about, he said. Anyway, I'm so sorry. It's so hard. Forgive me. So going back, my patient started talking. Acetaminophen, Tylenol is not an NSAID, okay? Acetaminophen, Tylenol is an antipyretic. You have to know this information. I want to talk about it because you're going to have more NSAIDs that you're going to present, okay? So Tylenol is a brand name, Tylenol. The generic is, Tylenol. The generic is acetaminophen. In other countries, the generic is called paracetamol. In UK, in Asia, it's called paracetamol, okay? I told you 99% of the drugs, the universal name of drugs is their generic name. However, this acetaminophen and paracetamol is one of the exemptions, okay? So Tylenol is a brand name, generic is acetaminophen. It's not an NSAID. I'm allergic to NSAID. So even if I have muscle ache, soreness, I cannot take NSAIDs. I cannot take Motrin. Brand name is Motrin. The generic is ibuprofen. Okay. Aspirin. Who's going to present aspirin? Maybe my Shauna. Oh, that's mine. Okay. Aspirin. Okay. Aspirin, abbreviated as capital ASA, stands for acetyl salicylic. Take note, this will come up on your quiz. Acid, okay? That's why ASA. Motrin, generic ibuprofen. Aspirin, generic or other term, acetyl salicylic acid. They're NSAIDs, non-steroidal anti-inflammatory drug. Tylenol is not. Celecoxib is another NSAID, okay? Tylenol, acetaminophen, not an NSAID. Miss L can take it. She's not allergic to Tylenol. So even if I have sore muscles or aches, I cannot take Motrin or ibuprofen, okay? There's a lot of information I'm going to tell you right now, okay? That's very important. These are over-the-counter drugs, but it is very important that you know them. Acetaminophen, paracetamol in other countries, brand name Tylenol, okay? The side effect is liver damage, okay? Liver damage. That's why there's a maximum amount that we can only take per day. No more than 5 doses usually is what you'll see on a acetaminophen bottle or label. No more than 5 doses because of its side effect of liver damage. Are you following? I'm on Tylenol right now. I'm on acetaminophen right now. Primary function of Tylenol is antipyretic, okay? This is also a pharmacology lecture, just so you know, huh? No, don't think that it's just drug words. It's part of our lecture, okay? Which I mentioned this in the audio lecture. I just want to recap. We're on Tylenol, acetaminophen right now. Primarily an antipyretic from the words anti, against, pyro, fire. So antipyretic is for fever, to lower elevated body temperature. The number 1 use of acetaminophen is an antipyretic. Number 2 would be analgesic, which is for pain. Antipyretic is to fever, analgesic is to pain. Third, very, very little on inflammation and swelling. Can you follow? That's for acetaminophen. Acetaminophen is abbreviated as APAC, okay? It is not an NSAID. That's why Miss L can take it. Miss L is allergic to NSAID. Clear? Okay.